Welcome to the deep dive. Today we're going deep on non-motor symptoms in Parkinson's disease. Most people know about tremors and slow movement and things like that, but we're going way beyond the surface to discover a whole other dimension of this disease. We'll be pulling insights from medical journals, research articles, videos, and leading organizations like the American Parkinson Disease Association, the Parkinson's Foundation, all that good stuff.
It's like we're uncovering the hidden part of an iceberg,
Yeah.
arming you with a deeper understanding of these symptoms, their impact, and really why it's so crucial to recognize them early on.
That's a really powerful analogy, that iceberg thing. I like that. So paint me a picture. What exactly are we talking about here? What lies beneath the surface?
Well, imagine the tip of the iceberg.
Yeah.
That represents those visible motor symptoms, right?
Okay.
But then you've got this massive portion submerged underwater. That's where all the non-motor symptoms reside. And they're often these invisible challenges that can have a huge impact on a person's daily life.
So can you give me some specific examples of these kind of hidden symptoms?
Sure. One of the most striking things we came across is that a large percentage of people with the Parkinson's, up to 62% in fact, don't report experiencing non-motor symptoms. And we're talking things like apathy, pain, sleep problems, you name it.
62%? Wow. Why do you think so many people stay silent about these issues?
Well, there could be a few reasons.
Yeah.
Some might feel embarrassed to bring it up, or they might not even realize those symptoms are connected to their Parkinson's at all. They might just think, well, this is just me. This is just who I am now.
Right.
And sadly, even clinicians can miss these symptoms sometimes or not really grasp their importance. So it's really a reminder for everyone, for patients and doctors, to look beyond those obvious motor symptoms and ask the right questions, and most importantly, really listen.
I think that's a great point. So let's dive into some of these specific hidden symptoms, these non-motor symptoms. What are some of the more common ones that we should be aware of?
Well, mood changes are really common. Things like depression, anxiety, apathy.
Makes sense.
Yeah, absolutely. It's a big life change to be diagnosed with a chronic illness. Then you've got sleep problems. Those can be very disruptive, insomnia being a big one, but also things like REM sleep behavior disorder. That's where people act out their dreams, which I can only imagine is a little scary.
Yeah, sounds pretty intense.
And then there's restless leg syndrome, which is that irresistible urge to just move your legs constantly.
Right.
And get this, sometimes these sleep problems can show up years before any motor symptoms.
Really? So they could be an early warning sign?
Potentially, yeah.
Wow.
And you have the cognitive challenges like dementia
Yeah.
and just slower thinking in general.
Right. And I know autonomic dysfunction is a big one too, right?
Oh, absolutely. That's referring to problems with the autonomic nervous system. The one that controls things like digestion, blood pressure, and bladder function. So we see a lot of constipation, bladder problems, and orthostatic hypotension.
Oh, right. Orthostatic hypotension. That's that sudden drop in blood pressure when you stand up. That can be really dangerous, especially for older folks, because it can lead to falls.
Exactly, yeah. And then rounding it all out, we have sensory changes, pain, and loss of smell are very common as well.
Wow, so it really affects the whole body, doesn't it?
Yeah, it really does.
But I want to move beyond just listing these symptoms, and I want to know how they impact people's lives. Can you give me a real-life example from what you've read about how these symptoms can actually affect someone's daily life?
Yeah, for sure. One source shared a story about a man who loved woodworking. That was his passion. But because of his Parkinson's, the fatigue was so severe, he just had to give it up.
Oh, wow.
He just didn't have the energy anymore. And that's just one small example of how these hidden symptoms can really steal away the things that bring people joy and fulfillment.
Yeah, that's really sad. It's easy to see how these hidden burdens could really impact work and relationships and just overall independence.
Right. And it's not just the symptoms themselves, it's also how they can change over time.
Change? What do you mean?
Well, this is where things get a little bit tricky. Our medical journal article talked about how some non-motor symptoms, like anxiety, depression, and fatigue, can actually become worse during what are called off periods. Those are the times when medication isn't working as well.
So it's like a double whammy.
Yeah.
You're already dealing with these tough symptoms, and then they get even worse when your medication isn't giving you the relief you need.
Exactly. And that adds another layer of complexity to managing Parkinson's, both for the patient and the doctor.
For sure. Recognizing these fluctuations is super important for healthcare providers because they might need to adjust the medications or maybe even explore different treatment approaches to really address those changing symptoms, right?
Absolutely. That's a really important point. Recognizing these fluctuations can be the key to more effective management and a better quality of life for people with Parkinson's.
Okay, so we've explored this hidden world of non-motor symptoms and how they can change over time. Now I'm really interested to hear what can be done about them. What are some of the strategies that are out there to help people manage these challenges?
Well, that's a great question. And the good news is that there's a lot we can do. There's a whole toolbox of options available, from medication to therapy to lifestyle changes, all aimed at improving quality of life for those living with Parkinson's.
That's great to hear. So let's dive into that toolbox next time. I can't wait to learn more.
Me too. So let's dive into that toolbox, starting with treatments. The good news is we have a whole bunch of options to work with. Pharmacological options are a key part of this. Medications, basically, you probably heard of medications like levodopa or dopamine agonists, maybe MAOB inhibitors.
Yeah, those were all in that video we watched from the Rocky Mountain Movement Disorders Clinic.
Right.
They did a great job of explaining how those medications actually work.
Yeah, they did. But, medication isn't a one-size-fits-all thing, right? It's all about finding that right combination and the dosages that work for each individual person.
Right.
Which means it often involves a lot of monitoring and adjustments over time.
So it's like personalized medicine,
Yeah,
tailoring the treatment to each person's specific needs.
exactly. But medication is just one piece of the puzzle.
Right.
Therapies with allied health professionals can also be really valuable in managing both the motor and the non-motor symptoms. I'm talking about physical therapy, occupational therapy, speech therapy, all of those.
Yeah, the resources from OHSU's Brain Institute were really big on that holistic approach.
Yeah.
They had some really great tips on how to work with therapists for some of those specific challenges.
They did. And then for some people, input from a neuropsychologist or a neuropsychiatrist can be really helpful too.
Right.
Especially when it comes to managing those cognitive and emotional issues.
It's about addressing the whole person, not just treating the individual symptoms in isolation.
Right on. And even when it comes to those less talked about symptoms like constipation and bladder dysfunction,
Yeah.
our sources highlight specific treatments that can help manage those as well.
Wow.
So there really are options available no matter what you're facing. It's all about improving quality of life, really.
That's great. And that kind of brings us to another exciting area, which is early recognition and the role of biomarkers in the future of Parkinson's. This was a big theme in all the research we looked at.
Yeah, what's exciting here is that it opens up the possibility of early intervention. If we can detect Parkinson's early, before all those significant brain changes have happened,
Right.
we might be able to actually slow it down,
Yeah.
maybe even halt its progression entirely.
That'd be huge. What's the latest in terms of these biomarkers?
Well, one really promising development is something called the alpha-synuclein seed amplification assay.
Wow, that's a mouthful.
It is. But it's basically a test that can detect this misfolded alpha-synuclein protein in the fluid surrounding the brain.
Okay.
And it's thought to be a pretty reliable way to actually diagnose Parkinson's, potentially even years before those motor symptoms start showing up.
That was mentioned in both the Mayo Clinic and the National Institute of Neurological Disorders and Stroke, right?
Yes, and it's cutting-edge research, but early data suggests it could be incredibly accurate.
Wow.
So imagine, being able to identify people who are at risk and then starting interventions early enough to make a real difference.
Yeah, that's amazing. We also saw a lot about the importance of lifestyle changes in the research.
Oh, absolutely. Things like exercise, diet, and stress management can make a world of difference for people with Parkinson's.
Right. Let's break those down a bit.
Okay.
Starting with exercise.
Okay.
What are some of the benefits there?
Well, exercise can help improve mobility, balance, strength, and flexibility. It can reduce fatigue, it can improve sleep, it can boost mood.
So it's almost like a natural medicine in a way.
It really is.
Right.
And there are so many different options out there for people with Parkinson's.
Yeah.
Walking, swimming, dancing, Tai Chi.
Oh, yeah.
The Parkinson's Foundation even has a whole section on their website about it, with exercise tips and resources.
That's great. So what about diet? Any particular recommendations there?
Well, there's no one Parkinson's diet per se, but a balanced diet, rich in fruits, vegetables, whole grains is always a good place to start.
Sure.
Staying hydrated is important too, and limiting those processed foods, sugary drinks, unhealthy fats.
Yeah, makes sense. And I remember a few sources specifically mentioning fiber for managing constipation, which we know is a really common issue.
Yeah, absolutely. And protein is crucial for maintaining muscle mass, which can be a challenge as the disease progresses.
Right. Should people be loading up on protein shakes and things like that?
I don't know about that. I think it's more about making sure you're getting enough protein throughout the day from a variety of sources, lean meats, fish, beans, lentils, all that good stuff.
Okay.
And actually, the timing can matter too.
Oh, really?
Yeah. Some people find that limiting protein early in the day can help with medication absorption.
Oh, interesting. It's a good reminder to talk to your doctor or a registered dietitian for personalized advice.
Exactly.
Okay, so we've got exercise, we've got diet.
Yep.
Let's move on to stress management.
Okay.
Why is that so important for people with Parkinson's?
Well, stress can really make both the motor and non-motor symptoms worse.
Right.
So it's really important to find those healthy ways to manage stress.
And I know several sources highlighted that link between stress and those mood disorders, like anxiety and depression, which are already pretty common with Parkinson's.
It's like a vicious cycle,
Yeah,
Stress can make those mood disorders worse, and then the mood disorders make it harder to cope with stress.
absolutely. So what are some effective stress management techniques that people can try?
Oh, there are tons. Mindfulness practices like meditation and yoga can be helpful. Relaxation techniques like deep breathing and progressive muscle relaxation.
Right. And, just spending time in nature, listening to music, pursuing hobbies that you enjoy. Those things can be great for stress relief, too.
Yeah, for sure. It's about finding what works for you, making time for yourself.
Self-care.
Yes.
So important. Okay, so we've covered a lot of those proactive steps that people can take. But what happens when those non-motor symptoms are really severe,
Yeah.
or they're just having a big impact on daily life? What other options are out there?
That's where it's really crucial to work closely with your healthcare team. They can help you figure out the best course of action. Maybe it's adjusting medications, maybe it's a referral for therapy. In some cases, there might even be surgical options to consider.
Right. I remember reading about deep brain stimulation, or DBS, which can be an option for some folks with Parkinson's, especially for those who are experiencing those severe tremors or those uncontrolled movements.
Right. It's basically a procedure where they implant these tiny electrodes in specific areas of the brain to help regulate those signals that cause motor symptoms.
It sounds pretty futuristic to me, but I've heard it can be really effective.
Can be, yeah. And researchers are always refining those DBS techniques and exploring new applications all the time.
So, more reasons for optimism.